The lumbar region physically supports your upper body, a complex network of vertebrae, discs, muscles, and nerves. Standing neutrally, downward pressure evenly distributes across these discs, acting as shock absorbers. But slouching and inactivity misalign weight, concentrating damaging pressure onto a single disc. This constant structural strain sets off the first physiological warning sign, a dull, persistent ache that lingers in your lower back long after you finish standing or sitting. For most people, lower back pain is the result of a slow, preventable mechanical failure of the body's primary shock-absorbing system. That internal breakdown quickly dictates your external reality. The strain bleeds into the surrounding muscles, forcing the body into an unnatural, rigid posture and severely restricting the everyday automatic movements you rely on. Basic mechanics become agonizing hurdles. Tasks that require a simple bend or twist, like tying your shoes, reaching for a pan while cooking, or vacuuming the floor, trigger sharp reminders of the internal damage. At night, the body is robbed of its primary recovery tool, sleep. Constant discomfort makes finding a pain-free resting position impossible, guaranteeing chronic sleep deprivation. Exhaustion and continuous physical pain create a vicious psychological cycle. Patients regularly report mounting frustration, severe anxiety about their mobility, and an increasing desire to withdraw from social activities. Lower back pain is an aggressive disruption that dictates exactly how much of your normal life you are allowed to live. To identify exactly what is failing inside the lumbar region, clinicians analyze the specific characteristics of the pain signals. These distinct sensations point to the specific internal component that has been damaged. A general, constant ache points to standard muscle strain. But a muscle spasm is distinctly different. This is a sudden, uncontrollable tightening of the back muscles that essentially causes a temporary paralysis, locking your movement entirely for seconds or even minutes. Then there is sciatica. When the structural failure escalates, a herniated disc actively bulges outward, physically crushing the delicate nervous system. You feel a sharp, electric shock sensation shooting from the lower spine, traveling rapidly down the leg. At this stage, many people try to mitigate the damage at home. They invest in ergonomic lumbar chairs, keep their feet completely flat, take scheduled 30-minute movement breaks, and switch to supportive walking shoes. Those habits are excellent for managing mild, early-stage muscular strain. However, posture correction is completely incapable of pulling a herniated disc back into place or repairing a crushed nerve. There is a definitive threshold where lingering soreness crosses the line into a medical urgency that requires professional intervention. The first warning signs involve time and trauma. If the pain persists continuously for more than a few weeks, or if it immediately follows a physical fall or injury, a doctor needs to formally assess the underlying structure. Next are systemic indicators. Back pain accompanied by unexplained fevers or sudden unexpected weight loss indicates a severe underlying condition requiring immediate diagnostic screening. Finally, we reach the absolute medical emergencies. The sudden onset of numbness or weakness radiating down your legs, or any loss of bladder and bowel control requires immediate hospital care. Ignoring these specific neurological red flags risks permanent bodily damage. By waiting too long, a highly treatable mechanical issue can rapidly decay into a severe, permanent health crisis. Lower back pain is a specific mechanical and biological problem, and it responds remarkably well to a precise, escalated ladder of medical treatments. At Arka Anugraha Hospital, that ladder begins with a strong foundational tier. This involves conservative physical therapy utilizing targeted core strengthening exercises, heat and ice applications, and clinical posture correction. For pain that proves persistent and disruptive, the next step involves targeted pharmacological intervention. Specialists utilize specific muscle relaxants and anti-inflammatory medications to break the biological cycle of spasms and swelling. If conservative treatments fail, especially in those severe nerve-impacting cases, the final tier utilizes advanced surgical options or targeted injections specifically designed to physically repair structural disc damage. Living a pain-free life is completely achievable. The medical team at Arka Anugraha Hospital in Bangalore is driven by a strict mission to deliver exactly this kind of modern, compassionate, and precise medical care. Lower back pain does not have to control your daily routine. Contact Arka Angraha Hospital in JP Nagar today to schedule a consultation, accurately diagnose your symptoms, and reclaim your life.